We are now joined by the chair of the Ready and Resilient Committee, Jeff Stein. Dr. Stein, thank you so much for joining us.
My pleasure.
Yeah, and to start us off, what have you in the Ready and Resilient Committee overall, the semester is about to be done in 1 week with in-person classes. What have you guys learned this semester?
Well, I think we have all learned a great deal. This was new for everyone. We were sort of, as they say, building this boat while you're in the water, and it really took the entire community for us to get to this point. I think everyone learned that this virus is a little more able to spread than we hoped, and that it's harder to fight than we hoped. I think we learned that our community is willing to make a lot of sacrifices to try to keep each other safe. But that really key effort of wearing a mask and trying to reduce the size of our social connections is imperative and the one central thing. But I'll tell you, we are going to make some changes for winter and spring based on other things that we saw occur. I believe that everyone on campus would agree that any one case is too many. While we know that there will be cases, we think we can do more to reduce the spread. Part of that is more testing and faster testing. So students can expect to see testing every week, and with the goal of testing hopefully at least half the student body every week. We would do that in a way that's a little more systematic so that students don't have to sign up for a time or wonder if they're getting tested, that sort of thing. We think we can add some clarity and consistency for students. You get tested every other week at this time, kind of thing. But I think we also learned that we needed some more staffing in certain areas in order to support students when contact tracing was occurring, when they were being quarantined or isolated. So those were key issues as well. And finally, I'd say, I think we learned that this is tough, causes great anxiety. Now, certainly this semester we had a global pandemic, a national election, and the country coming to grips, hopefully in a new way, with systematic racism. That's a lot of stress, but just the virus alone would be enough, I think. And that we need to help in reducing stress by creating some more consistent conditions, by helping all students in terms of well-being, by helping first-year students in particular to make connections and to be able to participate safely in student organizations. So hopefully students will see efforts in each of those areas for winter and spring, and we'll start talking about those in the coming weeks to prepare students.
Yeah, and to go back to the coronavirus testing, how much are each of those individual tests going to cost for students in the spring semester and even the winter term test if they're the same?
Great question. So, as you know, we were using LabCorp testing both for the pre-semester mail-in kits and then for the on-site. This week we are doing pre-departure testing for Thanksgiving. The state of North Carolina Department of Health and Human Services made tests available, antigen tests, to every university and college in the state. So we have taken advantage of that offer and are using these antigen tests, which are much faster in terms of producing results, but involve a little bit more work from our staff. So those tests are very inexpensive and other than the staff time. And those tests we're going to try to use both in student health services to reduce costs there, but also in our weekly testing. Our goal is to not have to charge students for the weekly testing or the return to campus testing. That's what we're working towards. Even though these tests are less expensive, there's cost involved, and we're trying to see what we can do not to pass that on to students, to make it free for students.
Yeah, and you said it's less of a cost plus of staffing, obviously, but how much in itself is the actual test going to cost individually?
Sure. How much is it going to cost the institution, you're asking?
Either that or how much is each individual test itself, just the test,
Sure.
no staffing.
Yeah. So when we started this fall, the LabCorp PCR tests, as you know, were $129 for that mail-in test that provided us with data and the ability for our entire campus to participate. The on-site testing that we were doing in Alumni Gym with LabCorp was actually more expensive because they were providing the staffing. When we switched to Radius Labs and that PCR, we reduced the cost to $85, but we had to direct a whole lot of staff, a number of staff volunteers to every time slot. The antigen tests range anywhere from $5 to $25, depending on the test. And I say that because we're still waiting on supplies, so we don't actually have a guarantee. No one really has a guarantee that new antigen tests will be when they'll be ready. So we're in line for a number of antigen tests to be able to provide those. The university would be paying $5 to $25 depending which test we use.
Mm-hmm. And do you have any worries as to the false positive rate or even the false negative rate with those antigen tests?
It's a great question. One of the reasons that we didn't jump on an antigen test early is we weren't confident with the accuracy, the sensitivity and specificity of some of the current antigen tests. The antigen test that we're using this week has very high accuracy rates and is even being tested as an asymptomatic surveillance test. So it's got a track record moving in that direction. And I think that's why the state wanted colleges and universities to use that test. Because of the potential for a false positive in a couple of cases, in a few tests out of a large number, we test every positive immediately with a follow-up PCR test. So there are measures you can take to make sure that that you're dealing with the false results that might come back.
Yeah, and then moving on a little bit to the procedure for the pre-semester testing for both winter term and spring semester. So before you come on campus, what is that procedure going to look like?
So we're still developing exactly how that'll work depending on these antigen tests and how many of them we can get for January and which companies think they might have them available in January. And I say that because if we do antigen tests, it's one sort of time frame. If we do PCR tests, it's another sort of time frame. But the most clear answer I can give you is that a few days before the semester begins, we'll start bringing students back. We will advertise that schedule for return in the coming weeks. We probably will try to bring first-year students back first so that they can have a little bit of time together. But I think you'll see that starting around Sunday, January 9, we'll start bringing students back, and they will get an antigen or PCR test on campus and then be able to be ready for classes on the 13th. And then we'll have to provide the same kind of testing process for those that either weren't here in winter term or leave for a day after winter term and before classes start for spring. So again, all of that will be released in the next couple of weeks, but clear schedules about when you can return and when your test will be on campus as opposed to testing before coming back.
Yeah, and then just to clarify, it is up in the air what exact test we're going to be using, or you guys are going to be using, for that on-campus pre-semester testing for winter term.
Correct. We have PCR tests ready to go. If we could use antigen tests and speed up the process for students and still have a highly accurate process, then we will use those as well. And as I said, we're signed up, but not all these companies, very few of these companies are able to commit to what their supply chain will look like in January. So the tests that we're using this week We've already signed up months ago to receive that in January. They can't yet commit to an exact date that they'll have them. We're also doing later this month, we're doing a bit of a trial and an experiment through the School of Health Sciences with another antigen test. So we're trying to cover all our bases, and it may sound like either we're indecisive or we don't have all the information, but really this is the most up-to-date information based on supply chain for these tests. And we're really seeing that the antigen test market is sort of exploding. There are companies that are still waiting on their FDA approval. There are companies that have just gotten their FDA approval, and they're working through the process of being able to supply these tests nationally to institutions like ours.
Yeah, and how does the university overall plan to recover from the cost of all these tests, especially if you can continue on with the PCR test versus the antigen? Where is this money exactly coming from?
That's a great question. So we have, as an institution and certainly through the Board of Trustees, had to set aside money this year planning for testing and planning for hotels for quarantine and isolation. So all of that is budget planning and trying to both pre-plan and in the moment figure out how we can best use funds to make sure we get everyone tested and that sort of thing. So it's an ongoing project, but something that we knew early on that we would have to do for the year.
Mm-hmm. So moving on a little bit, you talked about other things that you guys are planning on changing as far as the Ready and Resilient plan. We've been in the social hiatus for nearly a month now. Do you plan on continuing that into the winter term and even into spring term right now?
That's a great question. So I would imagine that as we complete the semester, we will change levels in the alert matrix, and that we'll begin from sort of a I guess if you will, I was going to say ground zero, but from a base level. We've learned that the external community in terms of Alamance County and the state are certainly experiencing an increase in cases just like the rest of the country. So I wouldn't be surprised if we're not at level 1 when we open in January. But I would hope that we would not be in social hiatus and that we're able to take what we've learned from the fall to create an environment where students are able to do as much as we can allow and have a little more engagement than can be had in the social hiatus. As I mentioned earlier, I think student well-being and mental health have to be key priorities in January and spring, because there's so much anxiety about COVID and the social hiatus and restrictions, I think, are tough. So we really want to try to create opportunities to be at a level 2 or something like that and still be able to have interaction and maybe even allow student organizations to meet in safe ways so that students have outlets.
Yeah, and speaking of the alert levels, do you anticipate at all a change in those in the coming semester? Any change in the alert matrix itself?
It's a great question. We created the alert matrix based on some models this summer before we really knew what the fall would be like. And so the data team and others have been looking at the alert matrix and what other campuses have done to see if there might be some tweaks that we make in order to better serve the campus, to provide more data that the campus has been asking about, maybe on the dashboard, but also to have less of these sort of rapid shifts that I think caused a great deal of stress. So we're really trying to model out, how did the semester go with the matrix? Are there any changes we would make, both in policy but in the matrix, to create more clarity? So that's a work in progress, actually, is a review of that and probably some information in the next couple weeks.
I'm curious, are you at all surprised that Elon did not go online for any period of time at any point during the semester?
That's a tough question. Am I surprised that we didn't go online? I think what we probably came into the semester expecting was fewer close contacts for each student. I think that changed how the semester went or proceeded because there were more close contacts. I think we've added this more testing because we know that with additional close contacts, the exponential spread is just at a much faster rate. And you got to have more testing to wrap your arms around that. And I think, in terms of whether we're online or in person, the amount of stress and weight on each member of the community as the cases increase was something that became very, very evident. And so I think our goal is to see how can we know that this is a natural kind of up and down process with COVID that's difficult to avoid, but we'd like to avoid such steep increases and that sort of roller coaster feel that I think everyone had, and try to flatten that curve a little bit.
Yeah, and so what are, especially for the winter term and spring term, what's going to be the tipping point for classes to go online?
That's a good question also. I don't know that I could tell you today what the one tipping point. I imagine that we will be looking at lots of data in the county, and really you're looking at how the virus is spreading on campus and how the student population, the faculty population, the staff population are being impacted specifically. We saw a great deal, and I didn't mention this earlier, we saw repeatedly that we were not finding transmission within the classroom. That's a great data point to know that wearing masks, being physically distanced, there was not virus spread within the classroom. And so we know that's a safer environment, that we were able to function well there and provide some sort of backstopping to avoid that spread. Those are the kind of data points that we have to look at. And I think you'd be surprised how many folks are looking at every single data point all through the semester to kind of see what worked and what didn't. You notice that we went back to dining the dining facilities being open. That's something that we looked at carefully. Certainly the weather had an impact on why we wanted to make that decision, but we weren't seeing that was having as much impact on reducing the spread. So that was something we wanted to bring back as quickly as we could, the in-person dining.
Yeah, and then you're saying that students are going to come back to campus and then get tested, but what about students who are coming from those really high-risk areas? There's lots of cases there. Do you think there's a chance that students won't be able to even make it back for winter term, or that you'll say that they can't come back?
I think everyone is nervous about what these increases in cases all over the country are going to do, and how this sort of rapid spread that we're seeing across the country will impact students' ability to come back to campus, how it will impact the state of North Carolina, how it will impact students' families. So I think we're all anxious about what the national numbers will do. We did make this change about testing once students arrive back on campus. That doesn't mean we won't want students to try to tighten their circle before they come back to campus, and maybe even test on their own before they come back to campus. But we know that it's going to be most effective in that situation right after New Year's and other holidays for folks to test once they've traveled and once they're here, and for us to get a handle on that. But I think we're all going to be watching the national numbers up before January and all throughout January and the early spring.
Mm-hmm. All right, and then recently at an SGA meeting, you said that you regret naming this whole plan the Ready and Resilient Plan, and also the level names and their meanings. Do you think there's going to be any change with how that information is communicated to students and even parents, faculty, staff?
Yeah, I think the point that I was referring to is, in a perfect world with 2020 hindsight, should level one necessarily be new normal, and did that green light or term new normal, would I choose that again? And I brought that up myself and said that's one thing I maybe wouldn't do, because this isn't a time in our lives when a green light is maybe the symbol, but I think that we'll continue to revamp communications, and we'll try to get as much information to everyone before January. And I would also say we're going to want input. I don't know that we had the perfect systems to get input from students, faculty, and staff this fall. Everything was moving so quickly. So we'll want more input as well, because it's all new. And I think we're all a little desensitized to this too. So we'll try to bring out new messages and make sure that every other week testing and all those pieces are able to communicate with folks. But as you know, going through this fall, there's a lot for all of us to learn. We've all kind of created our behaviors. We have to recenter ourselves on masks and decreasing our personal contacts. But it will be a challenge to be together, and I think we can rise to that challenge. But 20 weeks is a long time, and people are going to get tired, and we're just going to have to keep looking out for each other all through the winter and spring.
Are you thinking at all about adding any students to the Writing Resilient Committee?
We actually talked with SGA about how we might add students either in regular focus groups or to the committee or to some of our other subcommittees. So I think we will try to get student input through a number of different avenues, just to make sure that we're hearing students' voices. Typically, students are the best at understanding the student experience. So that makes perfect sense to have more students involved.
Yeah. All right. And anything else that you'd like to add?
No, I just would say that we owe a great thanks to everyone in this community for chipping in to make this possible. The faculty and staff who are volunteering this week in Alumni Gym are just one example of staff and faculty all over campus, students all over campus really making this possible. So our big message is thank you, and we'll see everybody back soon. We're going to try to get through the rest of this semester safely, but we wish everybody happy holidays, and we'll come back together and work through this together.
All right, Dr. Jeff Stein, thank you so much for joining us.
Thank you.